A very good evening, everyone. This is Dr. Shubham, and here I am presenting yet another interesting topic of psychiatry, which is the anorexia nervosa. So basically, anorexia nervosa is a very interesting kind of disorder. You must be, reading about this disorder uh, quite frequently. So here, if you talk about the anorexia nervosa, this is basically the disorder which is coming in the psychiatry. And in this disorder, basically the person will be having the extreme fear of weight gain, right? The patients will be having the extreme fear of weight gain, right? So in reality, the person is having, the person is actually not fat, but basically they thinks that they are actually gaining too much of weight. So in order to lose the weight, they will be doing some kind of activities. What kind of activities? We'll be talking about that. So the person behavior will be behavior. So some changes will be there. The changes will be like behavioral, and the dietary changes will be there. Dietary changes or dietary habits will be there that will prevent the weight gain, right? That prevent the weight gain, right? That is about this particular disorder which we are talking about in this anorexia nervosa. So basically, more commonly the females are the victims, right? More commonly it is seen in the females. And if you talk about the ratio also, ratio is around 10 to 20 is to 1, right? So 10 to 20 times in females it is seen as compared to the males, right? So this is very dangerous in terms of morbidity and the mortality of the situation. So if you talk about eating disorders, for example anorexia nervosa or the bulimia nervosa and the binge eating disorders, here in this particular session we are talking about the anorexia nervosa, right? So anorexia nervosa among all these eating disorders is having the highest rate of mortality and the morbidity among all the populations, right? And as I told you, females are very much prone for having the anorexia nervosa as compared to the males, right? What kind of age group we are talking about? If we are talking about the anorexia nervosa, so basically these are the younger females which are actually getting affected with this particular kind of syndrome, that is anorexia nervosa, right? So age more than 18 years, for example, right? So the younger population is basically affected. Younger population is affected as far as anorexia nervosa is concerned, right? So the person will be having basically extreme fear of weight gain and or the distorted kind of body image, so they want to lose the weight. That is the basic thing. If you talk about the BMI over here, right? BMI, everybody knows that it is the body mass index, right? So it is on the lower side. ICD, according to the ICD-11, right, it is less than 18.5, right? According to the ICD-11, right, which is governed by WHO, they say that the BMI is generally less than 18.5 as far as kg per meter square as far as anorexia nervosa is concerned, right? Now let me talk about the types of the anorexia nervosa. Very important. What are the types of the anorexia nervosa, right? So if you talk about the types of the anorexia nervosa, we are talking about two types over here. So the first one is that is a restrictive type, right? So the first one is the restrictive type, and the second one is your purging type, or I will say binge purge. Now what do I mean by that, right? Let me just highlight them as they are very important: restrictive type and the binge purging. So in the restrictive type, obviously as the name suggests, here what they will be doing is that they will restrict their diet basically. Okay, so what they will do is, in the restrictive type, they will be restricting their food intake. So they will restrict their food intake. So as they will restrict their food intake, they will be losing their weight, obviously, right? So they will be eating very less. While if you talk about the binge purge, so they will eat very less again, but whatever they will be eating, they will purge it out or they will vomit it out, right? So they will eat very less, but even after that, whatever they eat, they will be purging it out, so or vomiting it out, right? So purge out the food as well, right? So that these are the two types, restrictive type and the binge burst type. That's why in some patients it might lead to morbidity and the mortality as well, right? So here with this image you can see that this lady is actually not fat, this lady is thin actually, but looking herself in the mirror and thinking that she's getting fat, so she should be looking forward to reduce the weight. So in order to do that, one of the type she might be having, for example restrictive type, so she might be restricting the food intake, or if she will be having the binge burst type, she will be eating very less. Secondly, whatever she will be eating, she will be actually purging it out or vomiting it out, right? So that is a basic thing. Now what could be the symptoms if we talk about this particular case over here? So if we talk about the symptoms, let me talk about the symptoms as well over here, right? So what could be the symptoms in this case, right? So if we talk about the symptoms, they are very, very important. So the person might have the anxiety, obviously, they will be thinking about to reduce, how they can reduce the weight and all of those stuffs. They will be having the depression. Many patients, they went into depression because of thinking about reducing the weight and all. They will not be having the confidence, so loss of confidence will be there, obviously, right, because of having the image of body distortion. Now they might be having the amenorrhea. This is very, very important. In some MCQs, they, whenever they want to ask you about this particular anorexia nervosa, they will be giving the history of depression in the MCQ, or they will be talking about the amenorrhea in the MCQ in most of the cases, right? Then if you talk about further, they might be having the dry skin. This is the dermatological problem, and they might be having the hair loss, right? This dry skin, and one more thing, they might be having the lanugo. What is lanugo? Here in this image you can see the lanugo. It means that small hairs you will be seeing, like fetus, small hairs you can see on the surface of skin, right? So this is basically lanugo, right? This is basically lanugo. Okay, now these are some of the symptoms which you can actually see in the patients who are having this particular anorexia nervosa. Okay, now if somebody will be asking about some more symptoms, like for example, they might be having some of the patients, they might be having the osteoporosis. Due to that, they might be having they will be having the chances of getting fractures easily, right? With that, please remember that they might be having the heart rate on the lower side, bradycardia, hypotension, hypotension, and hypothermia, right? Hypothermia. So this is also very important, which you need to remember, because they are focusing on these things as well, right? Okay, now because they will be having tendency to vomit it out. For example, if I'm talking about this particular type, binge birds, so they will be losing the electrolytes also. So very commonly you can see that hypokalemia, there might be the hypokalemia, or there might be the hypomagnesemia, right? So this can also be seen over there, right? So extreme weight loss will be there. Obviously extreme weight loss can be seen because of these kind of activities, right? So that is the thing. Now these kind of patients might have the psychological effects also, right? And what could be the psychological effects in these cases? For example, the person will be not ready to eat the food actually. So due to that, there might be the conflict in the family also, that these patients will not be listening to their family members and all about the eating habits and all, and that is the basic thing. So their family members will be actually trying to convince them that they are not fat, actually they are not gaining the weight, in fact they are losing the weight, but they will not listen to them, and they will be thinking that they are fool, telling them again and again about reducing the weight actually. So that conflict might be there in the family members over there. So this is kind of a psychological part, that's why I'm telling over here. So family conflicts can be there due to these kind of thoughts basically, right? So they will not be ready to listen to their family members or their friends, for example. They will be having tendency to refuse the food, right? So refusal to eat the food, or whatever food they will be eating, they will be having tendency to purge it out, right? That's why, you know, monitoring these patients are also very important, because they might vomit whatever they are eating actually. Fine, but very important point over here is that they will be having the normal appetite, right? They will be having normal appetite. It's not that they're not having the appetite feeling. They will be having the normal appetite, but it's just that they will not be ready to eat the food actually. That is the main problem, right? Thinking that they will be getting more fat and they will be becoming obese. So that is the basic thing over here. They will be having tendency to do hyper exercise, right? Hyper exercise, this term can also be called as hyper exercising will be there. So they might, first thing is they are eating very less, and secondly they might go to the gym or they might do the hyperactivity in order to lose the weight actually. Again, this term is also called as the hypergymnasia, right? Hypergymnasia. So basically overall, I mean to say that they will be thinking in their mind, or they will be having that thought that they are actually fat or obese and they want to reduce the weight. So they will be taking all the steps to actually reduce the weight basically. So that's the basic thing, right? So once we understood this basic idea, okay, let me just go to the lab findings also, that what could be the lab findings, right? On the physical examination also, I told you that there could be the low BMI, which could be less than 18.5 kg per meter square. I told you over here itself. This is also very important. Sometimes they mention the BMI in the question, okay, and they ask you what could be the diagnosis over here. After this session, I will be talking about the bulimia nervosa, guys. So in the bulimia nervosa, I will be telling you that BMI is normal, whereas in the anorexia nervosa, the BMI is actually on the lower side. Anorexia nervosa and bulimia nervosa, they are very confusing, and every time they want to ask you these kind of questions, they will be putting both the options over there, so that you are very confusing, and some of the symptoms are actually overlapping as well. So that's why we should know the clear differentiating points between the anorexia nervosa and the bulimia nervosa. In the next session, we'll be talking about the bulimia nervosa. For now, we are just talking about the anorexia. Okay, so let me just go to the now the lab examinations also. So let's talk about the lab examinations as well. So if we talk about the lab examinations here, lab examination, so let's find out what we can see over there. Okay, so let me just change the color over here. Yeah, so if we talk about the lab examination, so we'll be seeing that we'll be taking the CBC of this person, and in the CBC you might find that there is leukopenia, low count of WBC. Okay, with that there could be lymphocytosis, okay, relative lymphocytosis, as the WBCs are increasing over there. Okay, if you talk about the serum electrolyte, I told you that the person might be purging out the content of food. So due to that, serum electrolyte will be on the lower side. For example, you might see the hypokalemia, and due to this hypokalemia, the person might be having the hypokalemic alkalosis. You know that due to the vomiting, the person might lose out the acid. So hypokalemic alkalosis might be seen. Why? Because of purging habit. Okay, why? Because of purging habit or vomiting basically. Okay, this is very important point. They might use it for for the MCQ purpose. Okay, now secondly, if you talk about the blood glucose, or if you talk about the fasting serum glucose, it will be on the lower side. So person might be having the hypoglycemia again. So plasma glucose might be on the lower side again, right? What else? You might check, the person might be having hypotension, bradycardia, that I told you. What about the LH and FSH? They will be on the lower side again. LH will be on the lower side, FSH will be on the lower side. Once they have asked you this MCQ as well, that what will be happen to the LH and FSH. Then cholesterol will be on the higher side. Cholesterol will be on the higher side, or the LDL will be on the higher side. Okay, that's why they might be having the dyslipidemia. Right? Okay, they might be having the increased level of GH, okay, increased growth hormone levels. So these are some of the changes over there. I told you about the amenorrhea already, that they might be having amenorrhea, they might be having hypothyroidism, that I told you already, right? They might also have the increased level of corticotropin releasing hormone, right? This thing has also been asked once, right? Okay, so these are the important points which I'm highlighting basically as far as these things are concerned. Okay, now let's move on and let's talk about some other points as far as this is concerned. Now once we have talked about all these kind of things, these patients are actually prone for having the cardiac arrhythmias as well. So if you talk about the cardiac abnormalities, cardiac arrhythmias are one of the complication I'm telling you, which can appear on the ECGs in some patients. Now what about the treatment, guys, over here? If you talk about the treatment basically, right, if you talk about the treatment over here, right, symptomatic treatment can be done. For example, hypokalemia, we need to balance out the serum electrolytes and all of these things. Symptomatic management will be done obviously, but other than that, what we can do for these patients? So psychological and behavioral therapy is very, very important, as we know that we are dealing with the psychological problem over here. So psychological and the behavioral therapy we need to do for these patients, right? Psychological and the behavioral therapy is very important for these patients, so we need to do these kind of things. Then the symptomatic management, for example, you can give some supplements of vitamin supplementation. You can take the help of vitamin supplements. So vitamin supplementation might need to be done over here. And symptomatic management, so you need to balance out the electrolytes at the same time, depending on what electrolyte disturbance is there. For cases of osteoporosis, for example, you need to give the estrogen as well. So estrogen replacement should be done. As I'm telling you that females are very prone for getting the anorexia nervosa, having the anorexia nervosa. So they might be needing the estrogen replacement. For example, you might give the OCPs, that is the oral contraceptives. They will be having enough amount of estrogen basically, and that will deal with the osteoporosis problem, right? Some patient might need the inpatient, might need the hospital admission basically. So those patients might need the hospital admission where the BMI will be very, very low. For example, for those patients, we will be considering for admission whose BMI will be on the lower side, as low as less than 14.5 kg per meter square. So we need to monitor them, right? Because cardiac arrhythmias and cardiac abnormalities, ST and T changes in the ECGs, and a lot of other severe electrolyte imbalances might happen. So we need to monitor them. So that's why we need to keep them under our observation. Okay, now next point, let's talk about the complications as well. Now complications are very, very obvious. What kind of complications might be seen in these kind of patients? For example, there might be the malnutrition, because they are actually looking forward to lose the weight, okay, without knowing that they are already very thin. And they might be having the amenorrhea, they might be having the delayed puberty, right? They might be having the delayed puberty, they might be having the osteoporosis, they might be having the electrolyte imbalances, right? So these are some of the abnormalities as complications which we can talk about as far as this anorexia nervosa is concerned. So overall, this is an easy topic. You just need to remember some of the points over here. So this is a straightforward topic as far as this anorexia nervosa is concerned in the psychiatry. So that was about the anorexia nervosa. I hope you enjoyed the session. If you did, please hit the like button, and please do subscribe and share it with your friends as well. I will see you in the next one. Thank you. Bye bye.